So we're going to end with a little bit of medical stuff, obviously. You can't have a doctor here without talking about some medical stuff. So the one thing that I feel like I hear from families when I hear that they called 911 or something happened was breathing. Like, is the baby's breathing normal? Is this okay? So I figured we'd just talk about what's normal and what's abnormal and kind of look at a couple of videos just to get a sense, so you can get a kind of a sense of how things are looking. So a normal neonatal pattern. So when you guys have premature babies, they are kind of in a different category. So even if they're 2 months old, they're still not 2 months old the same as a baby who was born at 40 weeks is 2 months old. So they're still kind of in that premature realm until they're about 44 weeks corrected. So once they're kind of past 44 weeks corrected, you can start thinking of them as their age a little bit more. But before that, you kind of have to think about them as premature babies who are getting more mature, right? And I'm sure you guys can probably talk about this a little bit, is that as they're passing certain age time points, you see them just like click into another level of maturity, just in terms of the feeding and the sleeping and the, kind of everything. You'll see that that something turns like once they pass 34 weeks. Something turns once they pass 38 weeks. Something turns once they pass 42, 44 weeks. You know what I mean? So these are kind of things where they'll just kind of jump up into a next level of maturity. But while they're still in the premature phase, a normal breathing pattern can be, it's considered irregular. So a baby who's first coming home is not going to breathe regularly. It can be fast breathing, it can be slow breathing, it can be all kinds of things in between. If you think about an adult who's breathing, we breathe at about 10 to 20 breaths per minute. But a baby who's first born is breathing at about 40 to 60 breaths per minute, and that can be okay. In addition to that, they can have pauses. So they'll be breathing 60, and then they'll suddenly pause, and you're like, are you breathing? And they can pause for 10 to 20 seconds, and that's still actually considered completely normal. Totally freaking out, but it's actually a normal breathing pattern. And breathing can be noisy. So that's, I think, something like, I'm sure you guys spend a lot of time in the NICU. You heard a lot of noisy breathing. There's some families who don't spend or aren't able to spend as much time in the NICU and probably don't recognize that babies are noisy breathers, mainly because they are obligate nose breathers. So the way that we breathe through our nose and our mouth, both, babies will only breathe through their nose, and that allows them to be able to breathe while they're feeding at the same time. So you can hear things like snorts, grunts, sneezes, whistling, and that's actually all normal sounds for the baby's nose to make, or for a baby to have still what we consider a normal breathing pattern. So if you look at the airway, you can have mucus or obstruction kind of anywhere along here, and it has different sounds that are associated with it and different levels of concern based on where it's going to be. So if you have a kind of a plug up here in the nasal passage, it can make your nasal passages more narrow, and even just something as simple as suctioning because they have a runny nose. Frequent suctioning of a runny nose can narrow the nasal passage and kind of exacerbate or worsen the problem. So if they get runny nose, it's part of like the beginning stages of a cold. But you'll hear the sneezing, the grunting, the whistling, because you're basically having air pass through a narrower opening. And it's not necessarily a problem. And we'll talk about when it becomes a problem. So if you go lower down in the airway, so here we go from the nose, and now we're in this part of the airway, the pharynx, and then the epiglottis and trachea. Sometimes you can have milk or mucus, especially if there's a risk for reflux or if they're having some reflux. So you'll hear gurgling in the airway and be like, is that supposed to happen? Like you can actually hear the milk or the mucus that's kind of back there. Most babies, full term, are able to protect their airway because they have a little more tone, they have a little bit more kind of body mass, and so they can handle swallowing it. And we, at that stage where preterm babies might be going home, they should be able to handle it, but it also can be something that freaks you out once you take the baby home initially. Does that make sense? And then if it goes lower into the actual airway itself, the larynx or the trachea, that would be like mucus. That's where you would hear a rattling in the chest. And if you put your hand, move this microphone. If you put your hand kind of right here on the breastplate, you can feel that rattling under your hand. That would be more like the developing of some type of an illness, like a respiratory illness. So oftentimes, like my friends who have babies will be like, can you come and check out my baby? I don't have a stethoscope, but I can just put my hands on their chest and basically know what's going on. Because you can feel that rattling when it's sitting right here. It's not down in the lungs. That sounds different. That's more of a cough. It's kind of sitting here in this higher airway thing, but it's making this sound like, you know, like, and it's like kind of down there, but you can feel it when you put your hand right here on the chest. And then if you get it obviously in the lower categories, this is where you're going to start to see illness, where they're going to actually have difficulty breathing. And we'll talk about that. So I want to take a pause and show you guys a video. And we'll kind of analyze it together. If I can find it. Okay, so let me back this up a little bit. Okay, so what do you guys see in this video of this baby breathing? Right, so his breathing rate is a little elevated, but if we count it out, like if we took a little stopwatch and we count it out, it's probably not more than 60. So it's probably closer to 60, but not more than 60. So you see he's kind of using his whole body to breathe. But what else do you have to pay attention to, which we try and point out when you're in the NICU? Look at the face. You know, not turning blue, nostrils not flaring, nice and pink. When you look at the chest, do you guys see it sucking in the ribs or anything like that? So this is actually a normal breathing pattern, but this is something that often freaks parents out when they go home, because they're like, you take your baby home from the NICU after 3 months and you're just watching them. Like, what are you doing? Is that normal? Is that not normal? Is that normal? So these kind of things can be a little tricky, but you don't just look at what's going on here. You want to look at how fast it is, count it out if you need to, but look at what's going on here in the face as well, okay? So we'll contrast with this video. What do you see here? Do you see a little bit difference in terms of the belly and the belly breathing? This is same belly breathing, but you can see a little bit more activated muscles being used as well. And the sounds the baby's making, you know, the grunting sounds, that's the baby trying to open the airway up himself or herself. So the difference between those two babies, you can see that kind of more clearly. This baby's, oops, that was a fast video. That baby is, oh, so it's gone. That baby, the last baby is still pink, but you can see there's some other things that are going on with the breathing that make it a little more concerning, right? Does that make sense? You can kind of tease out the difference. So you want to look at more than just what's happening with one thing, like is the belly moving or is the breathing fast? You want to look at, are we using other muscles to breathe?
Sometimes I think a lot of people will do a lot of grunting anyways, and that's not necessarily like associated with like an inappropriate breathing pattern.
Right.
So that's important to know because a lot of them will sweat all the time. Yeah.
And that's actually okay. So that just might mean there's a little something in there that he's, you know, he can't snot rock it out or whatever. As long as everything else is looking okay. And you can't assess breathing without getting a baby naked. You gotta take clothes off and look at the chest and the face together and see how is the breathing coordinated. When will this noisy breathing or these noises stop? So usually around 6 months of age corrected, they're gonna switch from being just nose breathers to nose and mouth breathers, more like the rest of us. So we should stop hearing as much noisy breathing, because if the nose is plugged up, they'll breathe through their mouth. And not only that, at around 6 months, their airways are a little bit larger. Their head control is better. They have more tone in their trunk. They're able to kind of coordinate head and trunk together. That's the time when they're kind of learning to sit up, like while you're holding them on their base and things like that. So you shouldn't be seeing this type of normal, noisy breathing after 6 months. So after 6 months, I wouldn't dismiss it. I would kind of think, maybe I should call a doctor. Why is this breathing not the way that we would expect it to be? And then when is it an emergency? So there are certain things that are, no matter what, are always an emergency. Wheezing is not normal. You guys know what wheezing sounds like? Like kind of those type of sounds where it sounds like you're almost struggling to breathe, struggling to open the airways. Turning blue, we call it cyanosis, never okay. Baby goes from being like this to limp, pass out. Not normal, 911. Fever in babies. So the first month of life, never okay. First 3 months of life, or from month 2 to 3 is a doctor visit or possibly an urgent care visit, but may not be a life-threatening type of a thing or a guaranteed infection. After 3 to 6 months, kind of use the judgment in terms of, is there anything else going on besides fever by itself? And then always evaluate the rib cage. If when you look at the rib cage, it's sucking in, there's a lot of accessory muscle use to help with the breathing, that's not normal. And then anytime the baby stops breathing and doesn't start again, that's also a 911. So do you guys have any questions just kind of about evaluating airway? Because that seems to be the one thing that parents feel the least comfortable doing on their own. Yeah, that's okay. That's absolutely normal, yeah. So grunting, whistling, snorting, sneezing, breathing heavily, as long as it's not, like short, shallow, rapid breaths that are greater than 60 breaths per minute.
What if those pop in intermittently?
That's okay. And it goes away pretty quick? Yeah, that would be okay. That's okay, yeah. Those are all normal. No, this is time to ask these questions. Those are all normal things, normal patterns of breathing. Any other questions about the breathing part? Okay. The last little thing I want to talk about is nutrition. Because we send you home on certain nutritional regimens, and there's a reason for it, but it may not have been explained why we send you home on what we send you home on. So we'll just talk about post-NICU discharge nutrition. So my personal area of research and interest in the NICU in neonatology is infant nutrition, just because in my experience, it's the most vitally important component. Whether you have respiratory disease or stuff like brain bleeds, all these different things, a lot of that can be overcome if you grow the baby well after they're born. That I think is the most important thing, because good nutrition early on can impact their long-term development. Absolutely. So we know that suboptimal nutrition, even in the first 4 weeks of life, and think about the first 4 weeks of your kids' lives, nasal cannulas, antibiotics, possible PDAs, like all of those things. We're even with all that going on, we're still focused on their nutrition, because if you don't give them optimal nutrition in that first 4 weeks, it can have a permanent effect on their brain growth later and eventually on their IQ. And I'm just telling you guys that, but I could show you all the studies. Like when I give this talk to other medical people, I show all the studies that show that brain development, if you give higher calories early on, is better. That IQ scores are better if you give higher calories early on. And then the highest risk for long-term delays are in the babies that are born small or less than the 10th percentile who don't catch up their growth. So even if you're born small and less than the 10th percentile at birth, if you have adequate or appropriate catch-up growth, your long-term outcomes actually are going to be okay. It's those babies that were born small and then never catch up that actually have the most severe delays, motor delays,
IQ delays, school delays, those kind of things.
What do you qualify